Dr. Crawford, thank you for joining us, and we look forward to your talk.
Thanks so much for having me. I really appreciate having this opportunity to talk about the lived experience, which is something that we talk a lot about, but as clinicians, as researchers, I really think it's important for us to incorporate some of that meaningful, enriched experience and really try to embody it in the work that we're doing. So the title of my talk today is The Role of Lived Experience in Achieving Health Equity. As previously mentioned, I'm the Associate Medical Director for the National Alliance on Mental Illness, which is the country's largest grassroots organization that's really geared towards improving the lives of individuals who are living with a mental health condition, as well as providing tools and resources for the caregivers in their lives so that they can better take care of their loved ones to ensure that individuals who are living with mental illness are able to live successful and productive lives. Next slide. So what I'm going to do is I'm going to talk about the variety of ways in which the lived experience can actually help address some matters relating to health inequity. And I know that we talk a lot about health disparities, which really has to do with the differences that we see in health-related outcomes. But I want to talk about what are the experiences of various patient populations of their everyday life. What is it that they're going through to help us better understand how we can improve care, treatment, and really develop tailored interventions to better meet the needs of these populations so that we can reduce some of these disparities and so that we can also achieve health equity and do this as a matter of justice as well. So I'm going to talk about how lived experience is knowing that people who have lived experience are experts by experience. I'm going to talk about how we can identify common gaps in treatment delivery and barriers to care, and also incorporating the experiences of those who are living with these conditions each and every day into the work that we're doing can essentially help increase overall patient engagement and overall well-being. And we'll talk about using it as a tool to reduce stigma. Next slide. The lived experience matters because as a society, we have been going through a tremendous amount of stress each and every day. And as a child and adolescent psychiatrist, I think about our youngest patients, what it is that they're seeing, what it is that they're experiencing in their world, in their everyday world. And what is it that the people who are living in their world, what are they dealing with? What are the challenges that they're facing? And what we see is that being able to listen to people who are walking this journey each and every day, again, can make us better clinicians. And I look at this picture here of this young girl during the height of the COVID-19 pandemic, during the height of the country's reckoning around racism. You can imagine, and I was hearing this in my own clinic, about how it was so difficult for kids to be able to identify the tools and strategies that they needed in order to move forward, in order to push through. And also looking at the adults in their lives who are also struggling to identify some of the tools and strategies that they needed in order to be well overall. Next slide. I talk about this because if we are listening to what the lives are really like for the people that we're trying to help with all of our interventions, with all of our clinical work, we can be able to better identify what are the tools that are needed in order to achieve equity, in order to make it such that everyone has access to what it is that they need to take care of themselves. But we also want to take it a step further and think about justice and think about the system as a whole and how we can improve and how we can create a system and provide the tools that are necessary so that everyone can have what they need so that they can be well. But we won't know what the tools are. We won't know what are the areas of potential opportunity and the areas that are lacking unless we are listening to our patients. Next slide. We talk about structural racism, which is looking at what are the policies and practices that are put in place that make it such that the environment in which people are living in, the systems in which they're interacting with in their environments, how is it stifling growth and progress in certain communities and allowing growth and progress in others? And being open-minded to hearing the stories of what people are going through each and every day is one way to address clinician bias, and also a way for us to have open ears as to how we can increase more access to what it is that people need in order to make it such that those who are living in the margins aren't continuing to be marginalized. Next slide. I mentioned structural racism because when we have certain policies and practices that have been put in place for quite some time that have been impacting more marginalized communities, they tend to also, what we see because of the limited opportunities, is that we see disparities in various outcomes, especially as it relates to health. And when we see these ongoing health disparities, we often are primed to make these associations that there's something about being Black or brown or being a part of this patient demographic that makes one vulnerable to certain conditions. But if we are continuously being primed based on what it is that we're seeing in the media, what we're reading in a newspaper, that has the likelihood to fuel implicit bias, unconscious bias, that makes it such that the system continues to be in place and that structural racism persists. Next slide. This is important, thinking about the unconscious bias, because that has an impact on the way in which our patients engage with us, the way in which they talk about their symptoms, the way in which their symptoms present, and how it is we interpret their symptoms. And if we continue to operate with this bias that's been reinforced by structural racism, that's been reinforced by not really listening to what the experiences are from individuals who are living in these communities, stigma is going to continue and treatment delays are going to persist, which again are going to contribute to ongoing disparities that we see. Next slide. So we see this in mental health. In terms of mental health utilization rates, the figure that you see over here is reflecting that of our youngest patients between the ages of 5 to 17, looking at who actually engaged in mental health treatment of any form. And you could see that our Hispanic patients and our Black patients tend to utilize mental health services at much lower rates than compared to our white patients. And the same data is reflected in our adult patient population as well, wondering what are the reasons why people are not accessing these opportunities to improve their overall health. What are the tools that they need in order to do so? But there are a number of barriers that exist. Next slide. And the disparities aren't just limited to healthcare. We see this in education as well. Having access to good quality education, being engaged in the educational system, and having higher educational attainment, we know that's been linked to better overall health outcomes. But what we see and what we've been seeing for quite some time is that there are ongoing inequities in the educational system as it relates to our Black students. And we see that there's a significant gap in abilities, in average learning scores across the board when we're comparing our Black kids to our other kids. Next slide, please. And then we also see these disparities exist when it comes to income, looking at the average household incomes for our Black households, for our Hispanic households, and also looking at food insecurity as well. So having difficulties with school, having limited income, having food insecurity, these are ongoing stressors that our patients are experiencing that we know are having an impact on their health. Next slide. And I say this because as a child psychiatrist, it is important for us to appreciate the adversity that our children are experiencing each and every day, the adversity that our patients, our adult patients are experiencing, because we know that has been connected to multitude of changes in neurodevelopment that we know can lead to various social, emotional, and cognitive impairments that we see that can ultimately lead to early death. Next slide. And we see this in our life expectancy data, in which you see across the board that our patients of color have life expectancies that are less than their white peers. Next slide. And I'm going to end by talking about how keeping all of this in mind is so essential, because stigma is a significant barrier to getting into care. If we listen to what it is our patients are going through, being able to see what are the barriers to accessing care, what are the tools and opportunities that are needed. If we don't listen, then we won't be able to have the opportunity to address stigma, to address the shame, the prejudice, the worry about discrimination, the worry about being viewed differently when it comes to entering the mental health system or any other healthcare related system to get the help that they need. And next slide, and I'll end here. We just need to make sure that we provide a seat at the table for our individuals with lived experience. It will be an incredible tool for advocacy to be able to empower our patient population and also to make policy changes that are needed. And we need their voices at the table too, to better inform our research, to make them more appropriate, and to increase overall quality of our interventions. Thanks so much for this invitation. I'm really looking forward to the discussion for this rest of the afternoon. Thank you.
Thank you so much, Dr. Crawford. I think a really important foundation that you set